Hi, my name is Dr. Yasser Osman, and I wish you all a bright future. And I wish to talk to you in this presentation about how to monitor the patient in the intraoperative period. Monitoring ensures continuous clinical and electronic observation of the patient so that adverse condition can be detected early and corrected before doing any harm. The correct use and interpretation of monitors can expect to help prevent anesthetic related morbidities and mortalities. Monitoring system can never reduce the importance of clinical observation in preventing and providing safe anesthesia using very simple measure including a finger on the pulse or ear to listen to breath and heart sound and an eye to see chest movement and patient color. What is the American standard of basic intraoperative monitoring? Standard 1. The anesthetist should be present in the room throughout the period of anesthesia. This is the first cardinal rule of monitoring. Objective is to monitor the patient and provide anesthetic care. While standard 2, during all operation, oxygenation, ventilation, circulation, and temperature should be continuously evaluated. We will start with oxygenation. Objective: to ensure adequate oxygen concentration in the inspired gas and blood during all anesthesia. Method: FiO2 monitored by oxygen analyzer with a low oxygen concentration limit alarm, so it will be triggered if the Fi2 is reduced. Pulse oximeter. Assess patient color. What is the pulse oximeter? It's a device that measures the oxygen concentration in the blood. It provides a percent of 100. The less the percent is, the less the oxygen concentration and hence hypoxia. It is depending on the connecting the device to the patient extremities, example a finger. This will measure the oxygen concentration in the arterial blood in that extremity. Ventilation. To ensure adequate ventilation of the patient during all anesthetics. Methods: clinical observation of chest expansion or the reservoir bag and auscultation of breath sounds. And tidal carbon dioxide monitoring, it is done by capnogram. Tidal and minute volume measurement, and ventilator disconnection alarm that is triggered when the ventilator senses that there is a disconnection in the anesthetic circuit. Capnography, it is the measurement of carbon dioxide in each breath of respiratory cycle. Value of carbon dioxide at the end of expiration is known as end-tidal carbon dioxide. In stable hemodynamic, end-tidal carbon dioxide approximate the PaCO2. Normal gradient between them is 5 to 10 mm mercury. End-tidal carbon dioxide increase in case of hypoventilation or rebreathing. And tidal carbon dioxide decreases in case of hyperventilation, pulmonary embolism, cardiac arrest, disconnection, or leak in the circuit. Circulation. To ensure adequate patient circulatory function during all anesthesia. Methods. Continuous ECG monitoring. The ECG monitoring is a good indication for rate and rhythm of the heart. Arterial blood pressure and heart rate at least every 5 minutes. Palpation of pulse and auscultation of heart sounds. Body temperature. The objective is to maintain body temperature during all anesthesia. Methods. Patient temperature should be measured when change in body temperature are intended or anticipated or suspected. Now, this is a picture of a multi-channel monitor. It shows the ECG waveform and the heart rate here. As I've said before, and this is very important, this kind of ECG tracing is an indication for heart rate and rhythm. Then the SpO2 concentration, this is a percent as we can see, and the waveform that result from the pulse oximeter. This is its channel. Then the CO2 and tidal carbon dioxide with its wave and its reading. At the bottom of the screen there is the blood pressure monitoring. It is automatic, so it measures every 5 minutes. This is the mean arterial blood pressure. This is the systolic and the diastolic. Important points. All equipment must be checked before use and all alarm limits should be set. Both the patient and the anesthetic machine must be monitored. Monitoring must begin before induction and continue until the patient has recovered from the effect of the anesthesia. The same standard of monitoring should be applied during all anesthetics, general or regional anesthesia. Monitors are not likely to be valued unless the anesthetist can recognize problems and act accordingly. In major surgery, more additional monitoring may be needed. Example, invasive blood pressure monitoring or cardiac output monitoring. Thank you.